The external auditory meatus is where our fulcrum is, so the ear hole is basically where our fulcrum is. And I want my stationary arm is perpendicular to the ground or vertical, and my moving arm is along the bottom of his nose or parallel to a tongue depressor. And so what I would have him do, and I would have this obviously on my side, but I ask my patient, just bend your chin to your chest. When he brings his head down, I just move this forward and I drop it down like that, okay? As long as you're keeping everything parallel, to the nose, you've got your measurement. So you're probably going to have to move your fulcrum forward a little bit because his head will come forward with that, all right? So that's cervical flexion. So your starting position is at 90, okay? For extension, it's the same thing. He comes backwards. Go ahead and look up. And now I'm just reducing the angle like that. So that's extension, and then come back to neutral again. I'm going to put my fulcrum there, okay? My stationary is lined up with the rest of his spine. And I ask him just to bend his head sideways like so, okay? Now, I have to make sure, and then I use the bisection of his head as my moving arm. So I'm basically bisecting his head as he goes this way, and then come back, and let's go this way. Now I want to show you guys something, and average is about 22 degrees for that. For cervical flexion and extension, what we're going to do now is we're going to have one inclinometer is going to be on the over T1. So let's get you sitting up nice and straight. So again, if we said this was C7, we'll say this is T1. You put your inclinometer right there, okay? Now what I'm going to do is I'm going to zero it out. So I have to turn the dial to 0. That's called zeroing it out. So I've zeroed that one out. The other one is going to go on the back of his head. And I can put this one down if I want it, but the other one is going to go on the back of his head. And they should both be facing the same direction. So back of his head, and now what I need to do is zero this one out. So hold on one second here. Just turning it so 0 is where we have everything lined up. All right? So both of them now read 0. I'm going to ask him to bend his head forward. So bend your head forward. Okay. Now, if you look at this one now reads, say, 70, and this one reads 20. Okay? So we take the difference between the two. So 50 degrees is what he would have for cervical flexion. Okay? You guys got that? So the important thing on this is that you zero them both out. All right? Now you do the same thing with extension. Okay? So we start them out, but instead of having this over T1, we're going to move this down to the spine of his scapula. Just go right over the spine of the scapula, zero that out, and then he moves backwards, bring your head backwards. Now in this one, you're probably not going to see a lot of change on that bottom one, but it still has to be zeroed out. Side bending is a frontal plane motion, so we want to take the inclinometer and align it in the frontal plane. So one is on top of his head, the other is right over T1. And now I ask him to bend his head sideways. So go ahead and bend your head to the right. We're good? Okay. And we got 45 here, and he didn't move at all here. So 45. But if this said 10 degrees, then what would my measurement be?
35.
35, exactly. So for side bending, we're here and here. My stationary arm is going between the two acromion processes. All right, so this is my stationary arm. It's lined up with the acromions. My moving arm is lined up with his nose. All right, so we're starting out at 90 degrees. Okay. If I will have him go ahead and rotate your head to the right. Yep. And I just bring it back. So again, my moving arm is lined up with his nose. And on David, I get, let's see, 70. It's a hard one to read. I get 76 degrees on that. So, and then come back this way. If you want to go from here to here, you can do that, or you can flip it around and do it like that. Either way is fine. I zero it out, and I just say, go ahead and rotate your head to the right. Okay? And 80 degrees. And now let's have you rotate to the left. 90 degrees. Okay?